Hello and welcome to an informational video provided by the Wisconsin Nurses Association and the Wisconsin Environmental Health Nurses Coalition, a mutual interest group of the Wisconsin Nurses Association. Today's presentation, Environmental Hazards, Pesticides, is presented by Dr. Kathryn Lammers and Jessica Christy, Leah King, Ashley Lewis, and Dani Bachmann of Winona State University. For more information on the Wisconsin Nurses Association and the Wisconsin Environmental Health Nurses Coalition, visit wisconsinnurses.org.
We are going to be presenting on environmental hazards, specifically pesticides and endocrine disruptor chemicals.
We are from Winona State University, and the nursing students that participated in this is Jessica Christy, Leah King, Ashley Lewis, Dani Bachmann, and the faculty member that we are under is Kathryn Lammers.
So let's start out. What is an endocrine disruptor chemical? It is a chemical that mimics or blocks the effects of hormones. An example that all of us can relate to is birth control. Then there's pesticides. Pesticides are substances that are used intentionally to kill, repel, or control a species. For example, some common pesticides that we use are weed killers, insect killers, and rodent killers.
So the Environmental Working Group is an environmental health research organization that specializes in toxic chemical analysis and has been able to come up with the 12 of the most toxic chemicals. And here's just a list of a few of them, such as atrazine and organophosphate pesticides, which we're going to mainly focus on, as well as dioxin, phthalates, flame retardants, lead, mercury, and BPA.
So let's talk about atrazine. Surprisingly, atrazine is found in 94% of our U.S. drinking water, and atrazine has many health risks associated with it. Atrazine alters enzymes related to breast, ovarian, and prostate cancer. It increases aromatase, which aromatase synthesizes more estrogen, which is linked to causing cancer. Therefore, cancer drugs aim to inhibit aromatase, which atrazine actually increases. Atrazine also increases the risk of birth defects, miscarriage, and preterm labor. Some sources of exposure of atrazine are runoff from our row crops and golf courses. And surprisingly, atrazine has actually been banned in European countries, but we still use atrazine on our plants and crops, and therefore it runs off into our wells, lakes, streams, and groundwater that we drink. And the highest level of exposure of atrazine is in the Midwest. There's 80 million pounds per year.
So some statistics that I want to just run off real quick. Chemicals or pesticides, they have been found in the umbilical cord, which means they cross the placenta, saying that it causes harm to the fetus. They have found about 287 chemicals within the umbilical cord, and of those, 180 are known to cause cancer in humans and animals. 217 of them are toxic to the brain and nervous system, and 208 cause birth defects or abnormal development in animal tests. This is all according to the American Nurses Association Principle of Environmental Health. And just another quick tip, I would highly recommend reading Tomato Land by Barry Estabrook to recognize pesticide effects related to birth defects and the development. Some more statistics, millions of pounds of synthetic pesticides are applied annually in the U.S. for agricultural purposes. So that is on our crops, our fields, and everything that we as humans can produce in the fields. In the past 70 years, the manufacturing and use of chemicals has increased more than 15-fold, meaning this is not just a concern that has just come up now. It has been happening over the last century. There's about 700 new chemicals introduced each year, and roughly 85,000 chemicals are on the open market, meaning anyone can go and buy these chemicals, put them on their fields, but only 1 to 2% are evaluated for health effects before they're put on the market.
So who is most susceptible to these pesticides? Well, there are a few developmental stages that are most susceptible. That is the fetal stage, infancy, early childhood, and puberty. And some behaviors that increase their exposure during their childhood is children putting everything in their mouth, crawling on the ground, and playing outside, being exposed to all the air pollutants and playing closely with the ground and fertilizers in the grass.
As mentioned before, the Environmental Working Group is a great organization and website to go on to look up new exposure risks that they may have growing concerns about. They also have a list of the Dirty Dozen and the Clean 15 for fruits and vegetables, and that just explains the higher risk of pesticide exposure that those fruits have and also the residue left on them. There's also another thing called Skin Deep. This is an app that you can put on your smartphone, and while you're going out in the grocery store or buying any products, you can scan the barcode of cosmetics and personal care products to look up their harmful effects and how they rate them. And also you can look up cleaning products as well.
There are many barriers as to why we are not decreasing our use of pesticides. Ethical barriers are socioeconomic levels, people's occupation, geographic locations. They might be in areas where there's an increased amount of pesticide exposure, and also access to healthy food choices. As Jess was talking about the Clean 15 and the Dirty Dozen, there might be people that have no access to the Clean 15 and our only choice is the Dirty Dozen. There are also legal and regulatory barriers. Funding and public policies, funding is just not there, and some of the acts and laws are not as efficient as they sound. An example of one of these acts is the Toxic Substance Act. Also, politically, there's a lack of consensus for reducing environmental risks. People are not agreeing on ways to decrease pesticide exposure.
So what we can do as nurses, it is our responsibility to be an advocate for our patient, whether that's on the individual or the systems level. We can teach our patients, we can educate them on prenatally about environmental concerns, the food choices that they eat, the fertilizers that they lay on their grass at home, and we can address any questions they may have. And lastly, on the systems level, we can lobby. We can talk to our politicians and ask for new regulations to be set to just help environmental health all around.
Then we have some professional organizations listed here that you can access for further information. Just a few of them are the American Nursing Association, the Wisconsin Environmental Health Nurses Coalition, and the others are listed there with their links to their websites that you can access.
And lastly, here's our references that we used. I hope you enjoyed our presentation and learned more about environment and pesticide use. Thank you.